So one needs to understand that rheumatoid arthritis, even though it affects primarily the joints, one can have extra-articular manifestations of this disease. And when I say extra-articular, this means outside the joint. Anemia or low hemoglobin is a common thing that we encounter in patients that have rheumatoid arthritis. That's because with all this inflammation that's in their blood, the body sort of decreases the production of hemoglobin. The second complication that we can see with rheumatoid arthritis is this generalized sense of tiredness, of fatigue. And this is to do with the inflammation that exists within their bloodstream. The third complication is muscle wasting. So when there is, again, chronic inflammation, or if they've been on corticosteroids or glucocorticoids or steroids for long periods of time. Another complication is loss of bone, something called osteopenia, and that can happen from the disease process itself, or it can happen from use of oral steroids for long periods of time. The most important thing to avoid the complications from rheumatoid arthritis, whether it's erosions at the level of the joint or whether there are other extra-articular manifestations, is to follow through with their treatment regimen. What the patient can control is, hopefully when the symptoms first start, is to go to a provider so that he or she is diagnosed early and then started on treatment early. I do ask my patients if they smoke, because smoking is associated with decreased response to treatment. There's enough research that's shown that eating a Mediterranean diet, which is rich in fruits, vegetables, fish and olive oil, decreases inflammation. So I sort of encourage my patients to switch to that if they can. So with regards to monitoring for complications, obviously following up with their rheumatologist on a regular basis is important. Anything that seems out of the ordinary or what is not their baseline, they should see their provider sooner rather than later, rather than just sitting over it, because it could be a complication that's seen with rheumatoid arthritis which they might not be aware of.